Hi, everybody. It's Elle, the creator of the Happy Birthday program. I've been wanting to talk about resources for a while, and so you're going to see me covering one here or there, okay? And so today we're going to be looking at Healthy People 2030. What is Healthy People 2030? If you work in healthcare, I hope you've heard of it. If you have not, or if you're someone who doesn't work in healthcare, Healthy People 2030, this is what it says, sets data-driven national objectives to improve health and well-being over the next decade. So what they do is every decade, so 2020, they had one that started in 2010, and they have these goals they want to achieve by the time the next decade rolls around. So in 2010, they had goals for 2020. Once 2020 was over, they created these healthy goals for 2030. Okay, so we're going to go ahead and take a look at this site. Healthy People 2030 has learn more about leading health indicators. They have graphics for how you can use it in your work. They have measures for overall health and well-being. It addresses COVID-19. They have tools for action. Okay, and so that's the graphic that we already talked about, evidence-based resources, how you can help promote Healthy People 2030. It gives you more information, what's changed from 2020 to 2030, what they're focusing on. And usually what they're focusing on are things that have become more of an issue. So once we achieve goals, then we've already achieved goals that really address problems we had already, we're going to move on to the next pressing issue. Okay, we're going to go back to the home page. And if you want to check out this site, you can either Google Healthy People 2030, or you can go to health.gov/healthy people, healthy people. Okay, it's up to you either way. Googling is usually easier in my opinion. So we're going to go ahead and take a look at objectives and data. Okay, and I want to talk about social determinants of health really quickly. So social determinants of health are those things that we encounter in our life that kind of dictates, maybe a year up, a year down in our lives. So where you live, do you live in the inner city where there's gang violence? Do you live in an area that has naturally occurring asbestos? There's all sorts of things. Do you live in the sun belt where the sun is out a lot and it's more likely that you're going to get skin cancer? Okay, all of those things are part of social determinants of health. So if we read about the social determinants of health, they break it down into economic stability, education access and quality, healthcare access and quality, neighborhood and built environment. So built environment, that's going to be the things we build. So a hospital, a home, a business, grocery store, etc. Social and community context. You can read all about this, and I would highly, highly recommend it because it's very informative and it helps you know how you can make your life and your children's life more healthy. And for healthcare providers, it really provides a way for us to look for things. So every decade on the decade, be looking for healthy people and go through it and really educate yourself. Social determinants of health have a major impact on people's health, well-being, and quality of life. Examples include safe housing, transportation, and neighborhoods, because if you live somewhere violent, you're probably going to be a victim of violence and you're probably going to have more stress in your life. Racism, discrimination, and violence. If you live in fear and you have constant stress, that will impact your body because what ends up happening is a few different things. Okay, so for one, your blood pressure is up and that wears down your blood vessels and it makes it more likely that you're going to have things like stroke. Okay, it also can impact your genes. What your genes do is they replicate, so they double, triple, quadruple, and it's kind of like they leave an envelope, right? And if the opening of the envelope gets damaged, then the stuff that comes out is more likely to get ripped up. So think of an envelope, right? And let's say that you only open part of it and you try to pull the whole paper out. Well, if you try to pull the whole paper out, it's going to get crumpled and ripped. So same idea. And when we have damaged genes, which happens if we have lots of stress and lots of bad things in the environment like pollution, etc., then the genes that come out tend to be damaged. And those damaged genes can end up being cancer. So you're more likely to get cancer. You're more likely to also have autoimmune disorders. What that is when you have inflammation in your body, That's going to be related to similar things as your DNA, right? When you have inflammation in your body and it's all of the time, and you have those stress hormones in your system all of the time, that creates your inflammation in your body. Okay, your body is irritated. Your whole internal system has too many hormones running that it's not built to have, and that ends up causing major problems that can lead to chronic health issues. So when we say autoimmune disorders, those are things like lupus, if you've heard of that, okay? So those are things that last for the rest of your life and can impact how long you live and certainly your quality of life. So this goes through and it really helps educate you. And if you're a teacher or something, this is great to provide students so they understand the way that health works. But what we really want to focus on right now is on pregnancy and mothers. Okay, so that's what we're going to do. We're going to go back to the home page. And we are going to click Objectives and Data. I guess we could have done that earlier. Didn't have to go back to the home page. We're exploring. It's all right, right? And we're going to browse objectives by topic. We're going to look at health conditions. Actually, we're going to look at health conditions. Let's do health conditions. Or you could just scroll down. It was just right there. And we're going to look at pregnancy and childbirth. Okay. So once you're here, you can read about it, but the goal is prevent pregnancy complications and maternal deaths and improve women's health before, during, and after pregnancy. So when you scroll down, you can read what common problems are and what they're trying to fix. So reduce the rate of fetal deaths at 20 or more weeks of gestation, reduce preterm births, and both of these things obviously are going to impact not just the health of the baby, but the mental health of the mother and the mental health of the family. Increase the proportion of pregnant women who receive early and adequate prenatal care. Increase the proportion of women who had a healthy weight before pregnancy. So that's important. It really does impact your pregnancy and the course of it. Increase the proportion of women who get screened for postpartum depression. That's something that I do. So yay for me, right? But back to the healthy weight. I don't know if you've seen the video that I filmed about beforeplay.org, and that is a health website about sexual health. And it really kind of talks about how important it is to make changes in your life before you become pregnant. Okay. That's going to provide a better growth environment for your child and better odds for your child and better odds for you too. Let's scroll down. Drug and alcohol use. Increase abstinence from alcohol among pregnant women. Increase abstinence from illicit drugs among pregnant women. Reduce the proportion of women who use illicit opioids during pregnancy. Reduce the proportion of unintended pregnancies. Reduce the proportion of pregnancies conceived within 18 months of a previous birth, and we're going to be talking about that. Reduce pregnancies in adolescents, which there has been a huge decline in adolescent pregnancies. That's great. Increase the proportion of women at risk for unintended pregnancy who use effective birth control. Increase the proportion of adolescent females at risk for unintended pregnancy who use effective birth control. Reduce the rate of mother-to-child HIV transmission. Reduce congenital syphilis. Increase abstinence from cigarette smoking among pregnant women. Increase successful quit attempts in pregnant women who smoke. Increase the proportion of women who get the Tdap vaccine during pregnancy. Reduce maternal deaths. That's important. We'll be talking about that. Reduce severe maternal complications identified during delivery hospitalizations. That's something we're going to be talking about. Reduce cesarean births among low-risk women with no prior births. Increase the proportion of women of childbearing age who get enough folic acid. Okay, and then you may be interested in family planning, which you could go look at that as well. And that's right here. They may have more information if you click on the other link. So let's go ahead and let's look at reducing the proportion of pregnancies conceived within 18 months of a previous birth. So if you have a pregnancy that's conceived before those 18 months are up, that would end up being, let's see, about 2.5 years apart, right? So if you do 18 plus 12, yeah, about two years apart. So you want your kids to be at least 2 years apart. Now, we don't always have a choice about that. Sometimes nature has a different plan, but we should want to try and control that. And if you're not sure why, maybe you come from a tradition where people have maybe 10, 20 children. That's like what they want to do. And so if they start having children in their early 20s, they want to have them close together so they can have a lot of children. That's, of course, your decision. But if you want to know the risks involved, we're going to dive in. Women who get pregnant less than 18 months after giving birth are more likely to have premature babies with low birth weight. These pregnancies are also more likely to be unintended, which can lead to other health risks for both the mother and the baby. Interventions to increase the use of birth control and family planning services for women who have recently had babies can help increase the length of time between pregnancies. So, this is, of course, again, totally up to you. But if you have other risk factors, like let's say you don't have a healthy weight, or maybe you've had babies that were preterm before, I would highly, highly recommend that you wait at least 18 months in between pregnancies because your baby is more likely to be premature. And we know that premature babies are less likely to survive. Also, low birth weight babies tend to have more health issues. So, all of these things matter. Unfortunately, there are a lot of moms who are completely unaware of this. They just think, oh, you just have a baby when you have a baby. In fact, my grandmother had 8 children, and my dad and his older brother are 10 months apart. 10 months apart. Goodness. And that was just the way of things. That was just how things were. Birth control was available, but it wasn't super common. And so my grandmother ended up having them 10 months apart. Now, neither one of them were premature, so they were lucky, but it did make things very difficult. I've talked to my grandmother since, and I said, well, what happened? And she said, I was stupid. Bless her heart, she's not stupid. But she talked about how hard it was and how she feels guilty to this day that her children, she doesn't feel like got what they needed. So that's something to consider. Again, this is a personal decision, and you just have to weigh your risks and the benefits. So scrolling down, I want to reduce maternal deaths. That is a huge part of my program, and we'll talk more about that. Women in the United States are more likely to die from childbirth or problems related to pregnancy than women in other high income countries. In addition, there are persistent disparities by race and ethnicity. Improving the quality of medical care for women before, during, and after pregnancy can help reduce maternal deaths. So, we actually have the worst rate of maternal deaths in the developed world. And there are several reasons for that. One very important reason is the rest of the developed world, by and large, has universal health care, and we do not. And of course, that's a value, and every country has their own values and their own system of doing things. But because we don't have universal health care, young women tend to not have health care because they tend to not be in careers yet. And if they don't get an abortion and they continue on with a pregnancy, they tend to get a later pregnancy check. So they will get obstetrics care later than they should. And when that happens, there's a higher risk of problems. Okay, so that's part of it. There are other parts of it, but that's one main portion. So I would highly recommend, if you think you might want to become pregnant, make sure that you have health insurance in place, a plan to get health insurance, or money saved up to where you can bridge it. Like if you need Medicaid, but you can't get Medicaid right away, soon enough to get to your first visit, what you could do is save money to go to the first couple visits before you get Medicaid. Okay, there's different things like that that are just practicalities that we need to consider. Something that I want to talk about as well is the risk of behavioral health leading to death. Now, I'll cover this in another video, but we know that maternal death, the cause of maternal death, varies by your race and ethnicity. While all of these things, right? So like hemorrhaging and mental health conditions and cardiopulmonary issues, they can impact everyone, and they do impact everyone, whether you're white, Black, Latino, Asian, Pacific Islander, Native American, any of the things, they impact you. But each group is impacted more by certain categories. For example, women, white women, tend to have more deaths associated with behavioral health. So those would be things like suicide or drug overdose. Okay, and we'll talk more about that later. But that means that we really need to address behavioral health. And that is something that I am looking at. Reduce severe maternal complications identified during delivery, and then reduce cesarean births among low-risk women with no prior births. We're going to click on that. Cesarean deliveries or C-sections can prevent injury and death in women who are at a higher risk of complicated deliveries or have unexpected complications. C-sections can also prevent injury and death in their newborns, but C-sections are linked to increased risk of infections and blood clots, and many women who aren't at higher risk for delivery complications get unnecessary C-sections. Various evidence-based strategies aimed at hospitals and healthcare providers can help reduce C-sections in low-risk women. So how does that impact moms? Well, moms, it's a risk to choose to have an elective C-section. Now, there are times when the choice is out of your hands, but if you can avoid a C-section, it is best that you do. And so that's something that you should discuss with your obstetrics provider. There are options. If you've had a prior cesarean section, you can have a vaginal birth after cesarean. You can have a VBAC. And also, if you're a first-time mom, as this is focused on, things like being induced increase the chance that you will have a C-section. So if you choose, you elect to be induced, that is a risk that you're taking on. Now, of course, this is something you should discuss with your doctor because these are all just general statistics. They're not about individual people. And your doctor knows you individually better than, all of the federal government can know the people, the population at large. So discuss that with them. But if you are thinking about having an induction, for example, really weigh the risks and the benefits. It's a serious decision, and it could have complications that go on. And there are other things as well, such as, if you go into the hospital really soon after starting labor, there's a likelihood that your labor is going to be prolonged. And in the hospital system, you're more likely to get Pitocin. And Pitocin is something that speeds along your labor. And once you have Pitocin, it can, lead to situations where you end up needing a C-section. Same with breaking your water. Okay, all of these things carry risk. They all have interventions. So really, to protect yourself, it is generally, so again, this is generally better to labor at home until you're in active labor and then go to the hospital or close to active labor. And your doctor will give you guidelines on how soon your contractions or how far apart your contractions should be. And they'll take into consideration how far away you live from the hospital, etc. Another thing is when you go in to the hospital, just make sure that you have discussed with your provider on what steps you want to take to help avoid having a C-section. So there are various decisions that can be made. Like, for example, when you get certain interventions, how you get certain interventions, who provides the interventions, that can really impact the outcome. All things to consider. All right, so that's mostly what I wanted to go over. Now, there are many other areas that you can look at. You can click on any of these things, and they all impact your health through labor, delivery, pregnancy, all of those things. And it can really inform you and help you understand the decisions your physician is making. It can also help you to hold your physician to a certain standard. You can look at these guidelines and you can see, is my physician making attempts to follow these? And you can research what those steps might look like. And then if you feel comfortable with the physician, you stay with them. If you have concerns, you can talk to them about your concerns, or you can choose a different provider that better suits your needs and what you want for your pregnancy. Overall, this is a great tool, though. I would highly recommend this for any woman who is thinking about having children, giving birth. I would recommend it for anybody just to learn about the social determinants of health. And something to keep in mind, too, as occupational therapists, social determinants of health are our jam. So, what does that mean? That means that we use social determinants of health every day in our interventions to prevent injury, to help you get better from injuries, to do all of the things. So, really, occupational therapists, this is what they are so good at. And if you are an occupational therapist or an occupational therapy student, I would highly recommend using this site in your work. All right, I hope this was helpful. Good luck with your pregnancy or with your studies or with your career. Best of luck. Bye.